and inpatient services as well. All good. Before we start, for those of us who are joining virtually on Zoom, there's some housekeeping items. We are recording this session, so all registrants will receive an email with the link to the recording. To minimize distractions, everyone will remain mute and their video will be turned off. Please use the Q&A feature at the bottom of your screen for any questions or to communicate with us during the session. For those of you in person with us, restrooms are located downstairs past our clinic doors to the College of Health Sciences on the first floor. There are signs to direct you just out this door and on the first floor. After this session, presentation, Camber will be kind enough to moderate the Q&A session. But now on to our main event. Tonight we are going to explore functional and integrative approaches to understanding women's health, as well as functional medicine modalities that can be applied to women's health with one of our new members, Dr. Heather DeHaan, who is board certified in family medicine and integrative medicine. She joined our team July 2024, and as I said, specializes in integrative medicine. She earned her medical degree from Boston University School of Medicine and completed her residency in family medicine at the Naval Hospital Camp Pendleton. She proudly served as an active duty officer and full scope family physician in the United States Navy. Dr. DeHaan furthered her expertise with a fellowship in integrative medicine at George Washington University, focusing on lifestyle medicine, nutrition, and functional medicine. She provides whole person care with an evidence-based and integrative approach, as well as comprehensive, individualized care that addresses the root cause of health issues. She seeks to optimize patient-driven care with a collaborative, team-based approach to guide the path towards healing and wellness. Her clinical interests include mental health, women's health, obstetrics, and pediatrics. You guys are in for a treat. Please join me in welcoming Dr. Heather DeHaan to Integrative Insider Live.
Thank you, Dr. Hatch. Firstly, I just want to say I'm really honored to be here, especially for those who came in person today. I'm really glad to share this time with a group full of women, whether you're part of our community, my colleagues, my mother and sisters at home, my friends, everybody around. So thank you for being here and listening to my special talk today. All right, so you already heard who I am. So. Alrighty, so the objectives for today, one thing I want you to take away from is kind of my point of view of what integrative health means. And I talk about this pretty often with my patients in clinic, as well as understanding what functional medicine means. And then just some of the functional medicine modalities I think that we can apply to women's health. So I'll start with my definition of integrative health and how I describe it. So integrative health is whole person care that's devoted to healing the mind, body, spirit, and environment to promote well-being with respect for preventative and therapeutic disciplines from across the globe, including conventional, traditional, naturopathic, functional, and breakthrough approaches. So this is how I view what integrative health is. It is a broad scope. This is another way to think about our integrative health. So this is the Wheel of Health that was made by the Osher Center for Integrative Medicine at Vanderbilt. It's one of my favorite ways to picture integrative health in a visual way. So at the center is the self, and that includes self-awareness of how we are and understanding ourselves, and also having self-compassion for ourselves, as well as all the things that involve our health. So that's our nutrition, our movement, our sleep, our circadian rhythm, as well as our mind and body connection, our spirituality, our relationships in our community, as well as all the things in our environment that affect us. And I will go into that a bit later. And then as far as our healthcare, we have preventative healthcare as well as things to keep well, stay well. So I created this image of women to create a sort of mind space or a vibe where I feel is a safe space. So I think about this representing the integrative healers, and this is what I consider an optimal healing environment. So this is a vulnerable place where you can connect to your mind and body with your healers. And part of the philosophy of integrative medicine is practicing what we preach. So because I'm doing a presentation today and there's nerves here, and I'm also really excited to see you, I'm going to start with a self-compassion practice. And if you feel like joining me, go ahead. So I'm going to set an intention for what I hope you take from this presentation today. And if you feel comfortable, you can rest your eyes on the image or down below and take a few deep restorative breaths. May you find words that speak to you. May you find your inner voice. May you find your truth. May you speak a word that speaks to you. May you speak from your inner voice. May you speak your truth. May your intentions be known. Today, my intention is to build community and hope that we can find our own transformative path towards healing and wholeness. So thank you for being here with me in this moment and sharing it. Okay, so let's talk about some empowering mantras. So patient-driven care is the patient is at the center of the care, that's the self. So these are some examples of words that I tend to share with my patients as I'm listening to validate their experience in the healthcare system. You know the most about you. You know when there's an imbalance in your system. You know what works and what doesn't work for you. Your intuition and instincts matter. You are your own best advocate. So these are things that I believe and I like to verbalize when I can throughout my visits to remember what it means to have that relationship and communicate with your provider. And I hope some of those speak to you. Alrighty. So one of the things I do when I have a new patient come in is I like to establish goals and understand each other from the beginning. So when I'm setting goals with my patients, I like to figure out our shared intention together, what we can accomplish during our visits, and really try to understand what my patients' actual goals are from the beginning. So these are some of the common goals that I hear from my females on a regular basis. So when someone makes a statement saying, I'm looking for a primary care provider, the most important thing I want to do is understand why. So get behind the meaning of what people are saying when they want a primary care. So the underlying meaning, I think, for finding a primary care is finding a relationship with a provider who can listen to you, who can validate what's going on, and actually will investigate underlying causes of what's happening in your body. Someone who provides comprehensive and individualized care that's not following an algorithm, and a provider who's trustworthy and compassionate. Other people ask for holistic care. We try to shift towards the word integrative, but what that kind of means is treating the whole person. So they want to address the mind and the body connection, as well as understand the spiritual aspects and our environmental contributors, and understand all the interconnections in the body, how they're related, while being open to exploring all modalities of healing. Another thing that I see women looking for is prevention. So they want to prevent specific diseases. They want to prevent heart attacks. They want to prevent cancer. They want to prevent dementia and what they've seen happen to their mother and their grandmother and their aunts and their neighbors. They want to detect disease at the earliest stages possible when they're reversible, when we can fully heal. They want individualized lifestyle guidance to optimize their health and promote longevity while aging well. Other women ask for understanding the root cause, which is our functional medicine. So investigate those underlying causes of the symptoms that you're feeling. Understand how those are interrelated in the body, and also differentiate normal from optimal function. So my plan is to optimize people, not have them not be diseased or normal. All right. So today, to explore some of the root causes, I'm going to use the common examples and just give an idea of why they're so important to me about the gut immune brain axis and the HPA axis. So those are my two big examples for underlying causes and some of the interconnected functions in the body. So we're going to explore those a little more. I'm going to drink some water. So if there's an imbalance in the HPA axis or the gut immune brain axis, the important thing to understand is it will create downstream imbalances in our sex hormones. So many women are worried about their estrogen, progesterone, testosterone. So the downstream effects do affect our hormones and our metabolic function, our thyroid and the weight that we carry and what's going on metabolically. So I look at these stages first before we kind of move on. So that's why I'm focusing on those today, and we'll talk about some specific examples why that matters. So the Institute of Functional Medicine has this beautiful functional medicine tree. So I'm gonna describe functional medicine as a comparison to conventional medicine. So in conventional medicine, we look at the leaves and the branches. We focus on the organ systems. Functional medicine, we're getting down to the roots because we need to heal the roots instead of focusing on the leaves and branches. Otherwise, we are not nourishing our full tree. So that means we need to explore these imbalances in our body. So some of the imbalances we explore are our energy levels, our immune function, like fighting our day-to-day infections, and triggers to our body, like allergens in our environment or the food that we eat that's triggering us. Our ability to detoxify, like through our liver, as well as eliminate toxins through our stool, how well we're having our bowel movements. So some signs and symptoms, that's in the trunk. Those are the imbalances that might be kind of vague in the beginning. So those are things like fatigue, brain fog, menstrual irregularities, disruptions in our sleep, or getting sick easily. So those are things that we might have before you reach a disease state. You might have more vague symptoms of fatigue. So the functional approach is to address the underlying contributing factors, underlying causes, triggering events, and really explore those to see what we can modify. So this is one woman's story. This is an example from the Institute of Functional Medicine, and I did embellish on it and create my own. So when I'm learning a patient's story, I try to learn it from as the beginning. So that's prenatal. That's your family history and even what you were exposed to in the beginning. So for this woman's story, we're going to learn and use her as an example. So she was a vaginal birth, but she did receive antibiotics while mom was in labor. That's because she had prolonged rupture of membranes. And then she was bottle fed. She quickly developed colic as an infant. She had her solid foods at 6 months like normal. And then she developed a lot of episodes of ear infections as a child, received a lot of antibiotics. She got her tonsils out when she was young. And then a significant event happened when she was about 7 years old. Her parents got divorced and her mother remarried a couple years later. Soon after, she started to develop abdominal pain episodes. The gastroenterologist evaluated, said there was nothing wrong except maybe she's lactose intolerant, and stopping dairy kind of helped her improve. Over time, she started to develop symptoms of depression throughout her teenagehood. She started to gain weight very gradually and slowly. She got married herself pretty young and had a couple of vaginal deliveries herself in her 20s. Both times she developed postpartum depression. And currently she comes in because she has gas and bloating, sensitive stomach to foods that she eats, low energy, feels like she can't pass her stools fully. And then I embellish a bit. So her mom has a history of thyroid issues and is gluten sensitive. She also has some eczema. She takes some ibuprofen here and there when she has headaches and menstrual cramps. She also takes antacids. She's been doing that since she was in college when she eats out, if her stomach gets upset. She's not been sleeping well really since her first child was born. She kind of is always a little bit on alert, waking up a lot. With the weight creeping up over time, she's tried a lot of the diets. She's tried keto and intermittent fasting. Oh yeah, and she was on birth control for like 12 years throughout, on and off. And over the past couple of years, in addition, these are less important, but she doesn't really have a libido anymore. She's having central weight gain and joint pains all over, and her sleep's really disrupted. Those are not, oh, by the ways, I'm making the jokes. Okay. All right, so just thinking about, to start with the gut immune brain axis, the things that I think, if we look at the functional approach of the imbalances going on here. So we'll start with assimilation. So assimilation is how we digest our food. So she has symptoms of heartburn, bloating, she gets loose stools. So she has a lactose intolerance, so she also kind of doesn't do so well with certain kinds of dairy. So her elimination and her assimilation are both out of balance. Other imbalances, she did have a lot of antibiotics growing up and even prenatally. So that can alter our immune system and our defense and repair. She was exposed to a lot of ibuprofen, NSAIDs, antacids, and birth control pills, which can change the structural integrity of our gut lining, our gut barrier function. The chronic sleep disruption will definitely interfere with her energy levels. And as far as communication in the body, which we'll get into a bit more, she has a lot of mood depressions, recurrent depression symptoms, as well as the central weight gain over time. These are all the communication of the neurotransmitters in our body, like serotonin and ghrelin, different hormones and neurotransmitters that are communicating differently, insulin. So that's a communication issue. Okay, so this is a small picture of the gut immune brain axis, just an example. And it's a pretty complex picture, so I'll go into things that are important. So this image depicts how the gut communication is complicated. I could talk about the gut for a really long time, so I'll try to give you some examples about the gut that I find interesting and intrigue me about how it's all connected. So for instance, the enteric nervous system, this is a simplified view of the enteric nervous system. This is basically the gut's own nervous system. So the gut has a nervous system. It communicates with our central nervous system in our brain. And it relays a lot of information. We also have this ginormous nerve called the vagus nerve that travels from our gut and goes throughout our whole body and sends all these signals to our brain constantly, as well as all the hormones and everything floating around. So our gut microbiome, all the bacteria and commensals, healthy things, are always sending signals. So one signal in the body that I think is interesting, the gut microbiota actually alter our brain-derived neurotropic factor. This has been shown to be a neuroprotective protein in the brain. And actually, it's been shown that that is reduced in women with premenstrual syndrome. So if you think about women that premenstrual get some brain fog, they probably have a little bit more neuroinflammation going on when they're sleeping, and they're not having that restorative BDNF being secreted when they sleep. If you haven't heard about brain-derived neurotropic factor, one of the things that boosts it, for instance, is something like L-theanine, which we get from green tea, and that helps us get kind of a little bit more restoration while we sleep. Some of the neurotransmitters that are made in the gut that many people know about, serotonin, for instance, 90% of our serotonin is made in our gut. Melatonin is made in our gut, acetylcholine, GABA, histamine. Our gut microbiome also produces what's called short-chain fatty acids. And we've been studying a lot of those short-chain fatty acids. One common one we study is butyrate. Butyrate tends to be very anti-inflammatory. It can alter our GABA regulation, and GABA is our neurotransmitter that calms our nervous system. So when GABA is dysregulated, we have a little bit more anxiety and brain fog. And actually, they've shown that even in PCOS, polycystic ovarian syndrome, that their GABA levels are dysregulated. And that's coming from the regulation that comes to the hypothalamus. And we'll look at what that looks like, how the gut immune brain axis is actually connected to the HPA axis. All of the inflammatory signals that are happening in the gut can also be stress signals. So we look at the epinephrine, norepinephrine, catecholamines. So all of these can be sending complex stress signals that is basically fueling our cortisol production. So I consider the gut barrier and all these chemicals and signals going on basically can create a kind of a chronic low-grade microinflammation in the body that's sending these signals that are perpetuating some of the issues that we can have and struggle with. So that's why I start with the gut. I'm going to give another example and bring it back to our case about dysbiosis. So dysbiosis, so eubiosis is when we have a healthy, balanced gut microbiome. Dysbiosis is when it's dysregulated. So that's the basic definition. There's a lot of things that can influence dysbiosis. So for instance, when I talked to my patient that we did that beautiful timeline on, I find out on her 24-hour dietary recall, she has some ultra-processed foods hidden in her diet. Those are yogurts, protein shakes, some blended coffees, some energy drinks here and there before her workouts. She also has some refined carbohydrates. She does have some bread and some protein bars that she has in there that have some refined sugars. There's also quite a lot of artificial sweeteners hidden into her protein shakes, things that she's choosing to be healthy. And then she does have some saturated fat. She still has some dairy exposure and some red meat in there. She just decreases how much she has. Her poor sleep is a sign of circadian disruption and chronic stress and immune suppression. So that will also influence her her gut barrier function. And the medications she's been exposed to, the antibiotics, the antacids, the ibuprofen, those are also going to alter her gut barrier function, which alters her immune response that's going on. So any kind of stressor, any environmental stressor, medication stressor, food stressor, those can increase intestinal permeability, otherwise known as leaky gut. And that will disturb some of our neurotransmitters and our HPA axis and lead to symptoms such as depression that she's experiencing. So when I see someone with depression that also has some of these kind of gut issues, we go back to the gut first. What's going on there? That was a long-winded explanation, but I hope it gives you some idea of how it's interrelated. And I did want to bring up one more thing, which is one of my favorite examples that I didn't add in. One of my favorite examples of things that start early is Parkinson's disease. So in Parkinson's, we actually, in some forms of it, can find that someone had constipation 10 years leading up to their symptoms. They're in the central nervous system. So actually, if we biopsy down in the gut, we can see early signs of the alpha-synuclein protein depositing, and it travels up the vagus nerve over time to the brain. So that's an example of a disease that kind of starts in the gut and progresses over time, but there's a functional disruption called constipation that happens way before that. So this, when I say the HPA axis, I'm talking about the hypothalamus, the pituitary gland, and the adrenals. So the hypothalamus is one of the parts of the brain that we say is dysregulated in a lot of us, that kind of triggers a lot of our hormone responses like hunger, night and day. Our circadian rhythm is very much regulated there. In states like PCOS, there's a lot of dysregulation going all the way up to the hypothalamus and the pituitary gland. And the big issue is cortisol. We talk a lot about cortisol, and I'll kind of say why I'm focusing on it a little bit later. So let's talk about some tests that we can do in real life. So I'm going to talk about the salivary cortisol because it interests me a lot. Just kind of understanding one way that we can actually look into the body by doing this lab. Okay, so let's look at a normal curve. I'm going to use my little pointer there. So this is our normal curve. So that is a normal cortisol production with our circadian rhythm. So when we wake up, that's when our cortisol starts to rise. It's kind of part of our waking response. And then it peaks within that first hour of awakening and starts to slowly go down throughout the day in a normal way. So that's a healthy circadian rhythm cortisol. We can actually test that with a 4-point salivary test in many labs. Let's go to some dysregulated patterns so we can understand them. For instance, we might have a chronic fatigue pattern. So in a chronic fatigue pattern, you're actually a little bit higher in the morning, and then you plummet in the afternoon, and you're actually much lower than the average person. So people that experience a lot of fatigue, especially can't get through their day, and they're really dragging, that is what a pattern you might see. There's also the pattern of chronic stress, and people who are chronically stressed, they might have a really high cortisol level, and then it kind of stays too high, and then they might have trouble sleeping later on in the evening. They can't settle down, a little bit of rumination, anxiety happening, and that could be driven by that kind of higher level. And then there's the burnout, which is one of the big ones I look for. So our body has a way of compensating with stress over time. And then after being stressed for so long, we start to burn out. So burnout can happen at any time in any stage, but that's when we no longer really can even make that response happen. And we stay pretty flat and pretty low. So these are examples of some patterns. If you have an elevated afternoon value, that is associated, that is also associated with dysglycemia, so altered glucose and insulin regulation. If you have an elevated bedtime, some people with the elevated bedtime get what's called a second wind, and they tend to think that they're night owls, and that's when they do all their good work. Sure, yes, maybe. Maybe that's your circadian rhythm type, or you're anxious and you're overworking to compensate. And the cortisol awakening response is a really interesting one, so we're going to go over some examples of that. So this is a really cool study that they did. They measured 2 groups, and they looked at the differences between them. So the cortisol awakening response is when you first wake up, 30 minutes after, and then 60 minutes after. So a normal response is this beautiful peak. That's the blue people. They're doing really well. Now, cluster 1, the red group, they have a blunted response in the morning. So they're not making a normal cortisol peak response. That is associated with people that had a poor sleep quality last night. So in general, they have poor sleep quality. So not restoring, they're not able to kind of have that morning wake up time. They also might have more central obesity and a larger waist to hip ratio. They also might have poor metabolic biomarkers that we can test for, especially in women. The high sensitivity CRP is an inflammatory marker that tends to be elevated in people that have a blunted response, as well as insulin resistance. So insulin resistance is the stage before prediabetes, but it is an early marker that there is some dysregulation going on in the body. So we're going to talk a little bit more about the cortisol awakening response because it is interesting. So people who had an early life stressor or multiple early life childhood stressors, and they tend to actually wake up a little bit higher cortisol in the morning, and they also have a blunted response. So that is a pattern that we tend to see if we check the cortisol awakening response in someone that had significant stressors. The interesting thing, however, about this study is not that that's going to be forever. That's actually modifiable. So it can be attenuated by caregiver warmth, as well as social support in adulthood. So I always like to look at the silver lining as what can we do? So we can build our village and we can ourselves be warm caregivers. So I do want to talk about caregiver warmth a little bit more. I'm sure many of us are caregivers, whether it's for our children, for our spouses, for our parents, for our family, for our friends, for our neighbors. So a lot of us have a caregiver role. My goal is to get people back to their optimized state, what they feel is their true self. And many women identify my true self. They say, it's calm, it's friendly, it's warm, I'm caring, I'm nurturing, I'm positive, I'm optimistic. That's who I really am. And so my goal is to get people back to feeling like themselves. One of the first questions I ask my patient is, when is the last time you felt like yourself? When was the last time you were able to show up with that warmth and that love? Okay. So I don't like to focus too much on the negatives, but a dysregulated HPA axis and cortisol has been associated with a lot of disease over time. So the common diseases that we think about: diabetes, obesity, cardiovascular disease, high blood pressure, high cholesterol, cancer, and especially how your body survives that cancer. Depression, anxiety, and ADHD. So those are all associated with altered cortisol levels. And again, the silver lining, supportive relationships are one of the most protective factors against what you've experienced in the past and how to regulate yourself further. And I love both of these images of how I envision kind of having that village of women to go to yoga together, to just go do something fun for ourselves. Okay, so I'm going to talk about, besides the cortisol curve, one of my favorite things to look into is people's wearable data. So a lot of us have these wearables, and not all of us know how to use them to self-monitor and change our lifestyle for the positives. So a few of the wearables my patients have: Apple Watch, the Oura Ring, the Whoop, as well as continuous glucose monitors, seeing what's happening to our glucose, and Abbott Lingo's over the counter, as well as looking at heart rate variability. And I really will talk to you about heart rate variability because it's one of my favorite things to look at, kind of on a real-time basis, what's going on in your body. Sleep tracking, so our Fitbits and our Apple Watches and our Oura Rings can look at our sleep stages. Are we getting enough deep sleep? Are we getting that 1.5 to 2 hours of deep sleep? Are we getting the right kind of REM sleep in the second half of the night? Also our menstrual tracking, so the Flow app. For our fertility and family planning. A lot of women nowadays are doing their menstrual tracking, as well for family planning. And then nutrition tracking, like MyFitnessPal chronometer, those ways to track kind of what's coming in, coming out, our macros, our fiber, our protein. So I'd love to share with you a little bit about heart rate variability if you haven't focused on this in the past. So how I think about heart rate variability, first thing I do is I breathe in. And I breathe out. So when I breathe in, I think about my heart rate quickening. When I breathe out, I think about my heart rate slowing down. So if I breathe in for 1 and breathe out for 2, I'm telling that my body is in a state where it's resilient and everything's okay. So I think about heart rate variability as representing our energy levels and our resiliency in real time. There's normal fluctuations in them, of course, but in general, heart rate variability is that beat-to-beat variation. It can somewhat represent our balance of our sympathetic, our fight or flight, with our parasympathetic or relaxation response, and how that's balanced. We can regulate it with deep breathing. It also can represent our emotional state. So if I pull up my heart rate variability in real time while I'm breathing, in the middle of clinic, sometimes I might be a little frustrated. And that's chaotic, but within a couple of seconds or minutes, depending on how trained I am with my deep breathing, I can get into a state of gratitude or appreciation. And that is when I consider that my breathing is coherent with my heart rate in the way that my body needs it. So if I'm breathing 6 breaths per minute, and I get into a really good flow state in yoga, I can get into a really nice coherent state where I feel resilient like myself. We can use heart rate variability to understand how well we restored our sleep at night. Look how we did overnight, as well as in the morning, if we're ready to do exercise that day, or if today's a day that I should rest and recover. So this will help us to modify some of these lifestyle factors. Specific ones that I think it helps a lot with is seeing the impacts of alcohol. That is pretty clear as to what happens to your resting heart rate, as well as your heart rate variability when you sleep that night. Our movement, so over time, if yoga or a HIIT exercise is working for our body. Deep breathing, Tai Chi, as well as biofeedback can be used to modify our heart rate variability. And shift work is pretty interesting for women. I'm sorry about that. So women are very vulnerable to shift work. And if we look at the data, women who are on shift work, like nurses are usually studied because they're an easy people to access. They tend to have more menstrual irregularities because of our circadian rhythm, more infertility issues, more metabolic diseases, breast cancer, and more sleep deprivation, such as those car accidents that happen in the morning after a shift. So women are much more vulnerable to those circadian rhythm disruptions that happen, and that can be tracked somewhat with the heart rate variability. I do want to talk about heart rate variability, just why I feel it's important and some of the research out there. It says that it predicts the morbidities from common mental health disorders like depression, anxiety, PTSD, as well as inflammation, chronic pain, diabetes, after concussion recovery, asthma, insomnia, fatigue. These all can increase your sympathetic output in your body and create a perpetuating cycle of autonomic imbalance in the body. And that increases what's called allostatic load. So they did a recent study on pregnant women with heart rate variability where they had them wear wearables. It was pretty cool. And they had never really done a study to see what happens during the trimesters. We know that the heart rate changes when we're pregnant, but over time, kind of what the normal is. So we used resting heart rate for a while, as well as blood pressure to monitor how a woman's doing. So for instance, if your resting heart rate's high, that represents maybe anemia or a high thyroid or some infections going on. But if we look at heart rate variability, we're able to predict gestational hypertension before it happens. We're able to predict postpartum depression and anxiety. We're able to predict someone's actual emotional status, if they actually feel stressed or feel less happy than normal in pregnancy. So we can use heart rate variability data to understand more than, I would say, kind of the common vital signs. So allostatic load and hormone balance. So this is a talk about women, so a lot of the times we talk about hormone balance. I like to think about hormone balance as more than hormones being low. I have low progesterone, I have high estrogen, although that's very important. So I like to focus first on the lifestyle. So a lot of that is the nutrition, how well we're digesting our food and nutrition, our gut health, our movement, our restorative sleep, our stress management, our spiritual nourishing, our social support, and our substance use. So those are all the modifications that we can look into for someone. Whenever we do this, it should be sustainable small changes, so we can only do so much at a time to focus on. That's a lot to just try to do perfect. We're not trying to be perfect people. We're just trying to make small, sustainable changes that really we can incorporate into our lifestyle. And I think these should also be personalized. So whether that's through some of these biomarkers that we look to or data-driven, if we want to use wearables to help us if we're into that. And also understanding our allostatic load, and that goes back to that functional timeline. So I'm going to talk a little bit about the idea of allostatic load and how this kind of progresses over time, or maybe ebbs and flows. So someone actually staged allostatic load in one of the studies, and I think this helps me to get a good picture from the words that I hear from people. In stage 0, we're able to manage our everyday life stressors. So we're cruising, we're feeling good. When we go on the weekend, we feel restored and ready to hit that next week. So we're basically able to restore our energy. Somewhere between stage 1 and stage 2, that weekend is no longer restoring us. That vacation is no longer helping us. We're starting to get some abnormal biomarkers. We're starting to show signs that we're having trouble with our sleep. We're getting a little dizzy, might feel some more irritability. We might kind of trigger a little faster than our normal baseline. We might feel some emotions a little bit more a little heavily than we're used to. So somewhere between stage 1 and stage 2 is where we want to try to reduce that. Because by stage 3 is when you actually get more of a medical diagnosis. So when you get a full-blown disease. Some of the biomarkers that we can start to see early in the point where your allostatic load is becoming too much. So we can deal with stress and we can compensate. We can deal with stress and we can compensate. We can deal with stress. Oh, look, another one. And then, you know, we have a new baseline of what we can handle, but it starts to become overwhelming. And when people feel overwhelmed and they say that word, they're at their height. So early on, when people are starting to struggle stage 1, stage 2, you start to see the CRP elevation, alterations in the cortisol and DHEA, and these are markers we can check, fasting glucose and insulin, triglycerides, the blood pressure, which can also be represented at nighttime with our heart rate variability tracking, our weight or our body composition changes, which we can do with body composition scales like we have in clinic, as well as immunosuppression. And for women, immunosuppression I see as persistent HPV infections, recurrent bacterial vaginosis and yeast infections, having skin infections like tinea or dandruff or intertrigo, and things kind of showing up where we get out of balance. So those are the things that I look for. So we'll talk a little bit about the perimenopausal transition. That's one of my favorites. So this is a time of pretty high allostatic load. Women are dealing with a lot of stress during perimenopause. So they're taking care of their kids, they're taking care of their parents, they have their job, they're at the peak of doing all the things, and they've had all these life stressors just coming like a roller coaster. So sleep problems are a big part of the perimenopausal transition, and this kind of perpetuates it. So waking up a lot during sleep, trouble falling asleep, waking up earlier than usual. So a lot of those sleep disruptions, a lot of headaches and migraines, things that make you a little bit less effective during your day. And I like to think about how women express to me that they're waking up at night. So a lot of women say that they wake up between 1 to 3 a.m. and they're just awake, and sometimes they just get up and do work during that hour and then they go back to sleep after. So this is in traditional Chinese medicine, 1 to 3 a.m. is the hour of the liver. So this is when you should be detoxifying in your body. There's a lot of other ways to think about the body, but the triple burner is between 9 and 11 p.m. and that's the really important time for the metabolic health. So I'm working pretty hard on getting people closer to bedtime between 9 and 10 if we can. I see people after 11 p.m. who do a lot worse metabolically, and it's hard to catch up, especially on that deep sleep. So just another way to bring in a little bit of the traditional medicine. And we're going to go through just a few of my favorite tests to think about and look at what's going on with the women. So especially with cardiometabolic disease, we want to optimize health early. So we look at some of the markers like the high sensitivity CRP, those inflammatory markers. We look at the metabolic tests more than just the A1C, which is screening for diabetes, but we look at things like insulin and glucose when you're fasting, as well as regulation of things like adiponectin, which regulates appetite and fat storage in the body. I would like to ideally check these kind of tests as early as possible. So puberty would be my favorite time to check these transitions and see if women are developing these metabolic issues, which we're seeing more and more with our younger generations. A lot of women come to me pre-conception, actually planning now 1 to 3 years before they want to get pregnant, and they want to be in their healthiest state. So this is a way that we can explore getting into your healthiest state beyond the conventional labs, as well as perimenopause. And that transition, you know, is a decade. It can be different in every woman's body, but knowing what's happening with your body as it's transitioning and what's changing is really important at that time when all of a sudden it feels like everything's kind of shifting. So one of the important things that I start with in one of my first visits is exploring the environmental toxic burden. So we're all exposed to toxins constantly. And one of the ones I focus on in the beginning is our water. So our beautiful Irvine water that has lots of arsenic and uranium and nitrates, things that cause not only cancer, but diabetes. So are you filtering your water with a reverse osmosis filter or using a carbon filter like Brita? So we explore all of these environmental toxins, what we are doing on our day-to-day, and what can we clean up? So what can we reduce in our personal care products, in our cooking pans and storage, in our home, in our furniture, in our transportation and the gasoline in the air and what we're exposed to fumes-wise on the road, the mold that's in our homes in a humid environment, our screen time, which is a big one we talk about, especially in the evening time and the artificial light, as well as the news and social media that we're being exposed to. And I would say social media is toxic. and the electronics as well as the electro and magnetic fields. And then secondhand smoke, not only smoke, but vaping. So I was driving and I saw someone vape from, I don't even know, 300 feet away. And within a second, I could taste it. And I was like, oh, this is wrong. So that's what I mean. And a lot of these things are endocrine disrupting chemicals, and that's what we want to identify. If you have any are disrupting your hormones or causing gut disruption, we want to find them and try to reduce them. So for instance, the arsenic, we want to reduce that. Phthalates in teenagers has been associated with ADHD. So in their skincare products, however much they're being exposed to coming out in their urine, in which we can use a lot of resources like the Environmental Working Group creates a beautiful database to see kind of what chemicals are in what we're putting on our skin. And the interesting thing is how a lot of these things that we're exposed to are passed down not only prenatally to our next generation, but epigenetically from generation to generation. So the old drug DES that was used in grandmothers not only caused infertility, but in the grandchildren is now causing ADHD. So that was from the grandparents' generation, and this is a well-known relationship. So we can do some of these tests in clinic. We can check your heavy metals and see if you're having high levels of arsenic and mercury and cadmium. We can actually check your gasoline fume levels, the MTBE. We can look for some of those forever chemicals, and we can do further testing for infections like tick-borne illnesses, mold and mycotoxins, EBV virus and long COVID, as well as understanding your genetic predisposition to kind of not be able to compensate or detoxify as well as other people when you're faced with these kind of toxic exposures. And then we'll talk a little bit about hormones, okay? Yeah, we're going good. So this is an example of a urine test that we can do to kind of see what's going on with your hormones. And this is when we look at the adrenal hormones and how they downstream to things like testosterone, which is normal. We want women to have testosterone, just not too much and just enough, especially during menopause. And we look at progesterone and its metabolites as well as estrogen. And the important thing about estrogen is how well your body's handling and detoxifying from it. So a lot of the environmental toxins we're being exposed to are called xenoestrogens, which means they act as if they're being estrogen in our body, and they're provoking what I call a more estrogen dominant state. And our personal ability to have enzymes that detoxify in our body, COMT is an enzyme that helps us to methylate, and we use cofactors like magnesium and our B vitamins to help us methylate properly. So we like to see if you're able to go down the COMT methylation pathway to basically metabolize your estrogen and pee it out or poop it out properly. Beta glucuronidase is one of my favorite. We can test it in the gut microbiome when we do our microbiome testing. So beta glucuronidase function can show that there's some gut imbalances that your microbiome is not able to fully detoxify or it's overwhelmed. And that can be seen in a higher fat diet, red meat and processed foods, as well as alcohol and antibiotics that can increase that. And some people need support if their beta glucuronidase is high. And then this is a picture of just the short chain fatty acids that are so important. And I like to think about, what can we do if it is not going well? So for instance, cruciferous vegetables or cauliflower and cabbage and arugula, those can be used to help kind of optimize that function within our own bodies if we're not doing as well as others. And then a lot of people need some methylation support. So this is a way to kind of find out if that's what's going on in your body. And then we'll bring it back to nutrition. I have to talk about nutrition every time I meet somebody. If we don't talk about nutrition, food is our medicine. So a plant-rich diet is something that I really like to talk about, having those phytonutrients. Every color that we have has a different nutrient. So red is our lycopene, that's optimized by stewing our tomatoes. Our green leafy vegetables, so good at preventing cancer. So one of the things I talk about is eating the rainbow, and I try to get one of every color every day. It sounds crazy. Our plant diversity is to aim for 30 plants a week. So that's not just vegetables and fruits, that's also our nuts and our seeds and our grains. So we try to have a really diverse diet, and that helps to diversify our gut microbiome so it can function and be anti-inflammatory and have all of the function it needs. So some of my favorite things are kind of Adding in some herbs and spices in there, getting a little extra color, maybe getting some microgreens. If you're having a hard time getting the large greens, you could do some broccoli sprouts, add those in, and some mushrooms. And then just to think about some of the health benefits of some of the foods. So green tea is one of my favorites to add into the diet. Green tea has really good benefits for cognition, for our bone health, for cancer prevention, for breast, prostate. So I love adding green tea. Ginger has a lot of good evidence, and a lot of people know about ginger. It helps with nausea. It also helps with migraines, and it also helps with menstrual cramps and arthritis. So a lot of times we'll add in things like turmeric root and ginger root, are very anti-inflammatory. And then soy gets a bad rap. It still does. I love soy. I just like organic, non-GMO soy. I think soy is protective for polycystic ovarian syndrome as well as breast cancer. So I try to have women incorporate soy in their diet, and a lot of women are still hesitant for that. I think those phytoestrogens, and when we look at what's happening in the gut microbiome, it is actually benefiting us, and it's anti-inflammatory. Okay, and we're going back to our happy space. So thank you for joining me here today. I'd love to answer some questions, but I hope that you have a little bit of hope coming out of this, because that's my intention. And I hope that you can either see me in clinic or find a provider that's on the same page as you that can offer all of these things with an integrative and functional approach.
We have some questions online. I don't know if anybody wants to get started in here. So, the first one is best way to lower A1C. What is the best way to lower A1C?
Best way to lower A1C, there's so many. I will always start with lifestyle, the right nutrition for your body, the movement, getting the right movement for your body, whatever you can do, getting the right amount of sleep, trying to get that bedtime earlier to 9 to 10. So lifestyle first and what you need. But there's also amazing supplements, natural supplements out there too, and herbs from our own environment we can use. So I wouldn't say there's a best. It's always, there's a lot of things we can do.
I have another. And this is similar, but how to lower inflammation. And then it says ESR. I don't know if that's someone's initials.
Yeah, ESR is like a chronic inflammatory
Okay.
marker. There's a lot of ways that we can lower inflammation, and it depends on the source. Like I said, I first look for the source if it's in the gut, for instance. If we have food intolerances like gluten or dairy or other food sensitivities that are triggering our gut, we want to reduce the things that are triggering our inflammation from the source. So we have to look for those underlying causes personalized.
Another one is there an easy detox drink I should do? I'm not making this up.
That's a great question. Again, it depends on the person, but in general, detoxification, it's really important to include some of those cruciferous vegetables, ones that you can digest as a person. Some people have a rough time, so like arugula is quite digestible, and you can do those as, you know, a real smoothie that you make. So more of a green smoothie. I would help detoxify things like infrared sauna. So there's lots of ways to detoxify the body. And pooping, making sure you're pooping multiple times a day if you can, at least once a day.
Any specific, I'm just reading them.
There's some
Specific diet for patient post-MALS surgery or MALS surgery.
So that sounds like an individual question for a single provider to address. So I'd like to individualize that one.
Okay. And the last one I have so far is just mainly a comment, but thank you so much for this lovely lecture. I have my first appointment next week, and it's made me feel so confident and comfortable.
Oh, yay. I'm looking forward to meeting you too.
Kimber, I think there's some questions here.
Oh, go ahead. Yeah, please.
What's your opinion about hormone replacement therapy? And does that affect the stomach lining in a positive or negative way?
Yeah, so it depends on the form. So a lot of us try to use more of a bioidentical form of hormone replacement therapy. So it's usually a transdermal estrogen on the skin. And then the progesterone is a micronized progesterone from wild yams that you have orally. So I see more estrogen taken orally as more of a gut disruptor, and that's what we see with oral contraceptive pills as well as hormone replacement is the oral estrogen.
So for women that are in menopause, you prefer the patch then?
The transdermal estradiol, yeah.
Thank you.
Do you see a limit on that in terms of age or postmenopause? I've heard 10 years postmenopause is a line, but I'm not sure if that's serious or.
Everything's individualized. Every story is unique, and we talk about risks, benefits together, where you're at on your timeline. There's no strict 10-year cutoff, but yes, 10 years after that, we're a little bit more cautious about the cardiovascular implications.
That's why, cardiovascular?
Primarily.
Okay.
So if I were to go to a physician like you, what can we do without it look like? Do you mind, like, how long are we together that first time? And am I gonna have all these tests and come out with all these things? Because I can check off so many things. So could you maybe like, what would that look like? Is that an intake that we talk about, or is that on a computer? How would that work?
There's so many ways that could work.
Okay.
My first goal when I meet someone is just to try to understand their story as well as I can. Try to identify some of the major imbalances and start with a starting point. And if that's a little things in the lifestyle and starting a little bit of the workup, but usually we have to peel back layers to everyone's story.
Okay. How long is usually the visit?
Our visits are an hour. I tend to dedicate the full hour as much as I can to my patient.
Thank you.
My question is similar. A patient coming here, are you ordering all of those tests? There is a lot of data that can be harnessed, right? Is it something after you find a story, does the patient go through, taking all these blood tests, right? They're mostly blood and saliva tests.
Everyone's priorities are different at different stages of life. Some people are experiencing significant signs and symptoms and want some answers. And sometimes we start at where the source might be. So if they're really not sleeping, that might be a major source. Or if their gut is quite dysregulated, we usually have to address that healing before we can go on to other parts. And that's usually what I peel back is what's the major imbalance in the body first. These tests, some of them are covered by insurance, some are out of pocket. So we also want to be kind of careful with what we can do through the conventional system to understand what is covered by insurance, as well as kind of identify where we're at going step by step. I don't like to do what's called the shotgun approach when we just, let's see everything. It's also overwhelming for what to do with that information.
And also, a lot of things you talk about sort of endocrinal, right? It's the doctor who is, what is it? Endocrinologist.
Mm-hmm.
So is that, so where the integrative medicine going to, it's a lot of endocrinology.
Yeah, and endocrine and the hormones, the thyroid, the sex hormones, the insulin, DHEA, cortisol. Yeah, that's a lot of that is endocrine hormonal.
And just one. So you mentioned something, there is a continuous glucose monitor, but then there is something you said, then there is something else.
Yeah.
What was that
You said
something?
something like that, and then there's
Like something like over the counter or something?
Oh, Abbott Lingo is one of the approved continuous glucose monitors that's available for people who are not pre-diabetic and not diabetic. So a lot of people are putting on the continuous monitors to see how their glucose is doing, buying it for themselves. They don't need a prescription.
Oh, they don't need it, and that something still goes through your skin,
It's,
right?
yeah, it's capillary. You just put it on like a thumbtack on your shoulder.
And it gives you, and it gives you information on.
Oh,
like,
yes, yes. It
So you
shows
can
the
come to the
fluctuations, the
doctor
spikes and the
with that.
falls.
Right, okay. Okay, thank you.
No, you go, go,
Are you
go,
sure?
go.
Okay, I have two questions. When you were talking about the bioidentical hormone replacement, has there been any research done on the bioidentical? Like, is it truly, like as close to our natural hormones as possible? Like, have they done research to like really verify that? Like
The research is still growing, of course, for women and their hormones. The Dutch test, sorry, I shouldn't say the test. The test that I do, that's one way to see individualized how your body's handling. If you do bioidentical hormones, I recommend that you do some form of monitoring in your body to see if you're metabolizing it well
Okay.
and if it's going well in your body.
Okay.
As well as, listening to your body and how it's responding, if it's getting symptoms of high estrogen like breast tenderness. So it's important to understand the full story.
Okay. And then my second question was on EMFs. And so we were talking about all the different ways that we can monitor, but yet there's all the research saying that it's emitting. So like, which is the lesser of two evils? Like, do we do the monitoring for a while to get some facts and then stop using?
Yeah, that sounds like a good way to balance, right? A lot of the times I say monitor for like a week or two and let's see what's going on a typical week. I'm not telling people to do a continuous glucose monitor forever either. I only want 2 weeks of data to see what's happening and see if you can make some actionable changes. So yeah, if you're worried about the Bluetooth exposure, totally reasonable to not always have a wearable. And you can also make sure you shut off the Bluetooth. And heart rate variability is one of those that is burning a lot. Thank you.
So I have 3 questions. What do you think about Ozempic and those type of medications? The other one is, I'm really happy with my primary, but if I came to you, would you work with my primary or would that be like integrated somehow?
Yeah, that's a complex question, but in general, integrative medicine should be transdisciplinary. So I think everyone should talk to each other. And if they're within the UCI system, I definitely reach out to all the specialists in primary care and let them know what's going on. I was a primary care myself, so I think it's really important that we talk to specialists and that we're on the same team together. So I'm conventionally trained, and I want to be a partner with them.
And the last question, do you have dietitians or do you make referrals to nutritionists, dietitians?
Oh, absolutely. We have one in the room. Wonderful registered dietitians, and we also have health and wellness coaches that work on the lifestyle, and they're very well versed as well in nutrition and movement.
But you would refer me to you, right? Or
Yeah,
do I
I would let you know who's a good match for you,
Okay.
get you in. Yeah, we
That's
have a
great.
lot of support for lifestyle.
Do you consider yourself a primary care or would you take that role?
That's a complex question for the system, so I can answer that in private after.
That's that word.
So I'm a clinical psychologist in private practice, just a few blocks away from here. And piggybacking on this question, how do you guys hear not just the doctors, but the nutritionists, et cetera? Do you guys interface with other practitioners outside of UCI, or it's all in-house?
I do. I've even talked to the IV medical spas out there. So I will interface, especially when I need to find out what's going on for somebody's case to help their health. So
Good to know.
yeah, I'd love to know the members of the community that are out there too and know who to refer to. So
Yeah, let's talk later.
I think we should wrap up, but I do have like a couple of fun questions,
okay.
just real quick.
Yeah, it's 6:30, just so anyone.
Yes,
wants to leave.
what is your favorite Blue Zone diet food to try?
Oh, Blue Zone. Well, yeah, I was stationed in, unfortunately not Okinawa, in Yokosuka, Japan. But trying Blue Zone food.
Yeah, what is or I was just gonna ask you, what was your unusual food, your favorite unusual food? That's what I was gonna ask you.
I don't think about anything as being unusual.
Oh, octopus.
Yeah, I would say I just was in Indonesia, so like all the fruits that they have there that I've never tried before, tropical fruits, you're just like, this is beautiful, and look at the color, and the taste is weird, it's in between this fruit and this fruit. So just trying anything new as well.
Now, can you smell the durian or whatever it's called?
Durian, yeah.
Can you
Yes.
smell it? Because it's a thing where you have a.
Oh, I
Okay,
guess I
smell it.
can, I definitely
Yes, you
can.
What's your favorite healthy snack?
Healthy snack. Well, I've actually decreased my snacking a bit for my gut health. I try to actually have meals and not snack as much anymore. A lot of people are grazing and I will definitely be a grazer. It's a fruit or a vegetable, but now I'm trying to pair with protein, so it's hard. Yeah.
And I have 2 more, is that okay?
Oh, yeah.
Do you have nutritional adjustment questions or suggestions to increase progesterone?
Nutritional
Mm-hmm.
ways to increase progesterone. Whew. Well, I know the supplements that I like to use, but in general, a lot of the times I'm not trying to, I mean, there are ways to boost progesterone. A lot of times I'm trying to decrease the estradiol when it comes to estrogen dominance. So it's usually that I'm trying to help you process the estrogen. Things like chasteberry, we use a lot to boost the progesterone, but usually it's trying to, decrease the estrogen. So reducing the red meat in the dairy, increasing the cruciferous vegetables, the flaxseed meal, the soy.
What are your thoughts on clove tea?
What?
On what?
Clove tea.
Clove? I would have to look up that one in my natural medicine database to see my thoughts. I've not tried it myself. I've not been asked that question before.
And the very last one is, any suggestions on how to find a doctor like you?
Well, firstly, our team here at Susan Samueli is amazing, and you can always go to our website and look at our clinical team, which is always growing. So we are also training the future practitioners here. We have a fellowship ongoing. I've actually taught them yoga and they're amazing. So we have the future of integrative and functional medicine is being trained here as well. So there will be more.
Are
Okay.
you still reserve or are you an active are you done with your
I
service?
served from 2011 to 2022 in active duty and then in reserves for a year. So I completed my service in 2023. I'm not going away, I promise.
So thank you for joining us tonight. Our next one's going to be in June with Dr. Ryan Herring. He's our concierge primary care physician, or not primary care, sorry, our concierge physician. And just, we have our Women's Wellness Day coming up May 2nd. It is currently sold out, but you can get on the wait list or register for the virtual event. Thank you.
Thank you.